Congestive heart failure, potential lethal diagnosis on its own. However, what if it's accompanied by early liver failure and kidney failure? We're going to discuss a patient that we cared for just these problems. Welcome again to Montgomery Heart and Wellness for another session of Clinical Rounds. Camille and I are going to be here discussing a patient who had congestive heart failure, but also liver failure and renal failure. We all know that congestive heart failure is a potentially lethal disease. Can you just sort of share with the audience how he presented to us and some of the challenges we have to deal with?
So he was a 46-year-old man, and he has the advanced heart failure, which had caused secondary liver failure. And he also had fluctuated between stage 3 chronic kidney disease and a few other stages. He had atrial fibrillation, high blood pressure, diabetes, and was on insulin. He had really low energy. When he presented, he was fluid overloaded on his first day.
He had just gotten out of the hospital, I think, 2 days prior. So this is a man who had been in and out of the hospital every 2 weeks, having to get IV diuretics. Prior to coming here, he had to be started on an intravenous diuretic. A very complex patient. One thing I'm going to outline, I won't go into too many details, is that heart failure, one of the ways that people die is what's called pump failure. So you can have multi-organ failure when the heart starts to fail. So then the kidney starts to fail, the liver starts to fail, and you have these conditions with heart failure. You know that gout is an inflammatory condition, and inflammation underscores pretty much every chronic illness. So he was dealing with this gout, and I think that this was probably the driving force. At least we had to decide whether it was the driving force or not. So what was our first approach? What do we do with this patient?
Just cold pressed juices, vegetables, and fruits only. Those nutrients would be absorbed better for him because he had a lot of bowel edema, which is seen in heart failure and liver failure. Because of that, we had to stop the insulin because we can't have somebody becoming hypoglycemic. That can kill somebody really quickly. And his blood sugars did absolutely fine and great off insulin. We did a lot of good diagnostic testing and found some other things that were abnormal too.
He was on how many meds? About 8 or 9? Or?
So total, yeah.
Yeah, and he wasn't taking all of them consistently, which is a problem we see with patients on a lot of medication. So it makes it very confusing to determine, what's working, what's not, because they're not taking them all the time. They're causing side effects and the like. He's short of breath. He's in the clinic, and he's teetering on having to go to the emergency room. And here at our center, we treat patients in this fashion. We gave them a fairly large dose of diuretics. We were able to get blood work. And of course, as you mentioned, importantly, we put them on the raw detox. And lots of people don't realize how important that is. So taking off cooked foods, even off solid foods, can help reduce inflammation. So this helped them turn around quite quickly. We started them on some specialized anti-inflammatory nutrients, liposomal curcumin and others. So our approach for him was to immediately attack the underlying inflammatory condition. He came for infrared sauna. He got the ozone therapy immediately. And here's, with patients like this is where nutritional, integrative, and regenerative care come together. Patients with these advanced illnesses, they benefit from this exact approach. When you start the nutrition, it's the foundation. And so this started working with him. Liposomal curcumin started to shut off the inflammation. Along with the food started to shut off the inflammation. Along with the ozone started to shut off it. So we were hitting him in different directions, and we had a major synergistic effect on his inflammatory condition. So it was like, spraying a major water hose on his condition. We were essentially treating him almost like an inpatient with daily labs, daily IV diuretics, until he started to turn the corner. But we noticed something within day, 3 to 4 maybe, that he started turning the corner.
Yeah.
He was having lots of pain from the gout, had a hard time turning his neck. The next step was to evaluate his heart rhythm.
Right.
And he was in atrial fibrillation.
Right.
Now, what is the problem with atrial fibrillation and heart failure?
So when the heart is beating irregularly, which is what atrial fibrillation is, then that can actually contribute to reduced cardiac output. You don't get all that blood going into the left ventricle. Over time, that can lead to an enlarged heart, a weaker heart. And that's exactly what he had. His heart was pumping at 11%. And so we need to correct the rhythm, make it regular, with the hope to improve forward flow from the heart, and then that can improve other organ function as well.
But the sick of the heart is you need all 4 chambers functioning normally. And he, because of the atrial fibrillation, the upper chambers are not functioning normally, the lower chambers are just doing their best. So he was functioning at less than half the cardiac capacity. So we had to work to get him in atrial fibrillation. So what we did, again, here's the integrated part. So we had to put some allopathic medicine in it too. We put him a loading dose of amiodarone, and we scheduled him for an outpatient cardioversion. And we did what's called a transesophageal echo. It's an ultrasound probe that's passed through the back of the heart. We look for blood clots. If we don't see any blood clots, we then shock the heart into rhythm. Continue with the detox, continue with the integrated nutritional therapy, etc. Over time, with his heart beating in a normal sinus rhythm, we saw some amazing changes. Now this is a normal rhythm with continued raw detox, with the other supplements, with the ozone therapy.
Well, from a symptom standpoint, he was walking faster, moving around. He was in a better mood, not having all the fluid retention. On his echocardiogram, the ejection fraction was now looking closer to 30%, which is a huge increase. And markers of liver dysfunction went down by nearly 50%. So that was amazing.
Yes. So, and as we said at the beginning, the inflammation was driving this. So to see the inflammatory markers go down was a good sign that the overall underlying inflammation was going down. The hemodynamics got better because he was in a normal rhythm. So the heart circulation was more efficient. Pressures on the heart went down, so that's a sign that less congestion on the liver, and there was better flow to the kidney, so there was evidence that the kidney was better. So this gentleman who came to us, he flew in to Houston from somewhere in Southern California, and we only had 4 weeks to help get him turned around. As we followed him remotely with return visits to the clinic, I think he has a good chance to make a very, very meaningful recovery. Any final thoughts for the audience?
Yeah, I mean, I think overall this is a great example of the integrative approach. You know, that's what we do, is to spread the word that people can get better, and he's doing so much better now.
Great. Always a great story to hear. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.